Good evening, everyone. It gives me immense pleasure to welcome you all to this edition of Fever Foundation Quiz, and it is organized by Fever Foundation. I just briefly would like to tell you about Fever Foundation. Fever Foundation is an independent, non-commercial foundation supporting the educational and academic activities, and it is to address the unmet needs in fever management. The foundation is committed to conceive, build and sustain program and to make scientific initiatives which are aimed at providing evidence-based update to healthcare professionals. The vision of Fever Foundation includes to strive towards imparting knowledge on the unmet needs and also to provide information on research, education and therapy updates on fever management. We have several activities being conducted under Fever Foundation, some of which are we conduct annual fever conferences, fever CMEs. We bring about books on fever management, clinical epidemiological research, challenging case presentation competition for postgraduates, young scholar awards, patient education, paramedical education, public awareness, and parent educational activity. Today we are here for a fever quiz competition for postgraduate students in general medicine. Today we are competing for the zonal zone. And once the winner of the zonal, all the zonal team is available, all of you will be competing in the national level quiz during the FEPCON. With this, wishing you all the best, I hand over to Dr. Krishna to take it forward.
Thank you, madam. A very warm welcome to everyone joining in today for the zonal quiz. This is from the North Zone Fever Foundation quiz in internal medicine. This is being conducted with the able guidance of Dr. M. Maya and Dr. Muruganathan. Today we have the senior professors and the teacher of teachers. Both of them does not require any introduction, but as a formality, I would like to welcome and thank you for Sudarshan sir and Narsimlu sir for joining in. And Dr. Sudarshan sir is the chairman Karnataka State COVID-19 Technical Advisory Committee member, and he heads the committee, is the chairperson there. He's been the ex-director, retired dean and principal and professor and head of community medicine from KIMS Bangalore. He is the member of the World Health Organization expert consultations on rabies. He has authored multiple chapters on multiple subjects in many books, as well as more than 100 publications to his credit. Welcome, Sudarshan sir. Thank you very much for joining in.
Thank you.
Also, we have Dr. Narsimlu sir, senior consultant rheumatologist at GVN Medical Care. Has been the past president of the Indian Rheumatology Association, former dean ICP and API. He's been the former professor and HOD rheumatology at NIMS Hyderabad, former assistant editor general of Association of Physicians of India. Also is the member of syllabus committee for rheumatology MCI. Thank you, Narsimlu sir. Thank you for joining in.
Thank you.
Also, we have Dr. Anupam Prakash, Dr. Amesh Agarwal, and Dr. Shubha Lakshmi madam joining in as experts today. The quiz host today, Dr. Ghanshyam Pankte sir, welcome sir, is the Director Professor, Department of Medicine, Lady Hardinge Medical College, New Delhi. Is also the in-charge rheumatology clinic and in-charge medical ICU at LHMC. He has more than 100 publications to his credit. He is also the associate editor, API Textbook of Medicine, the 9th, 10th, and the 11th edition. He is also the MD and NBE postgraduate teacher and examiner of Delhi, AIIMS, and Rajasthan. Thank you, thank you, Ghanshyam sir. And it's over to Dr. Sudarshan sir to read out the rules and regulations.
Yeah, thank you, Dr. Krishna Kumar, for the introduction of the host and also the mentors and the postgraduates in general. I am going to read the rules of the quiz for today. The quiz is for the postgraduate students only. The quiz consists of a multiple choice questionnaire. The option to be selected by clicking on the button on the text panel. The video display with options will be only for representation purpose. The participants are advised not to leave the platform. Once answer is submitted, it will not be possible to revert or retract. It is over and final. There are no negative marks. The winner will be the maximum fast right answers. The winner is one who gives the maximum and the fast speed and the right answers. If there is a tie, there will be a tiebreaker round and will be done to decide the winners. It is advisable to use the laptops or desktops. Next. The participants are advised to come from a place with good internet connectivity. Please ensure that. If found to be any type of foul play, the participant will automatically be disqualified. The participant should not use mobile phone for getting answers from any colleagues or somebody sitting by. Fever Foundation is not responsible for any form of technical error, like poor net connectivity and all. Participation in the quiz implies that participants accept the integrity of these rules. The participants who have given incomplete or inaccurate personal and contact details will be disqualified. Non-compliance with the rules results in the automatic cancellation of the participation in the quiz and of the candidacy for the prize. First and second winners from each zone will enter the national level quiz at the Fever Foundation conference known as PEFCON 2023, scheduled in November 2023. The quiz masters and the judges of the jury's decision is final. Next. So with this, I wish all the participants all good luck, and the best of the two, I expect them to win. And now it is handed over back to quiz host. Yeah, quiz master. Yeah, Dr. Ghanshyam Pandeji.
Thank you, sir. Thank you, Dr. Sudarshan, sir. Thank you, Dr. Narasimha, sir. Thank you, Krishna. And we will be having this fever quiz. And I will just like to again highlight that this will be a 20-question quiz. And each question will have 4 options, and only one will be the most appropriate one. And the winner of each question will be noted, and the fastest finger first person will be selected. So you have to answer it as early as possible, as soon as the clock starts. Okay. So fastest finger first will be chosen for every question, and the maximum answers done by any student will be the winner at the end of 20 questions. So with the quiz, I will just say best wishes to all of you, and let's hope we have a very entertaining and a very academic quiz 2023. We had similar quiz by Fever Foundation last year also, with very good participation. And the winner, there will be 2 winners, one winner and one runner-up, and both will be selected for annual Fever FIFCON conference in Bengaluru, which will be held in November. So we will be selecting 2 persons from here who will be winner and runner-up. So before starting, I will just let you know that we will run 3 dummy questions. So how you have to answer those A, B, C, D. Out of them, one you have to choose. And we will project first question. So Computer Ji, can we have the first question for this North Zone quiz? Okay, so everyone is ready. We can start first dummy question. Just make sure how to answer these questions. So question number 1, what part of the body helps you move? Is it eyes? Is it muscle? Is it pancreas? Or is it lungs? Your time starts now. It's really difficult question. The answer should be the fastest one. So as soon as this buzzer starts, 20 seconds, you have to click if you know the answer. But you cannot revert back. Once answered, that will be logged by computer. Okay, so time is over. This was the first dummy question. you must have seen you cannot touch the screen here, A, B, C, D. Instead, you must be having the option at the bottom of the screen where you can select that what is the answer. So I think most of the answer will be A only, because eyes can only help you in moving. So Computer Ji, can we have the answer?
Muscle.
Oh no, it's a B answer. So muscle is the correct answer. Computer Ji, can you let us know how many percentage of the students correctly answered this?
Yeah, Oliver, sir.
Oh, it's a B. It's 100%. So most of them have correctly answered this, and it was not eyes; it was muscles,
Yeah.
which move you with your limbs and all. So this way you have to answer it, and I will suggest if anybody is working on their mobile phone, kindly shift it to a laptop or a desktop, because that will help you in answering more easily. Okay, so we can go for second dummy question, Computer Ji. So what is the young one of a cow called? Is it puppy? Is it kitten? It is calf, or is it baby? Your time starts now. So you should know something about veterinary science also, not only human science, and not only pediatrics, veterinary pediatrics also. Okay, so I'm not able to see the screen, just a minute. Sorry for it. Just a minute. Some issue with my iPad. Okay, sorry for the trouble. So what the young answer is calf, C. So young ones of the cow is called calf. I think most of them have again correctly answered 100%. I hope this percentage will continue with next R20 questions, not only in dummy question. So Computer Ji, can we see the percentage score? Okay, so 100% again. So very well done. All the students are very ready, and we can go ahead with the next question, Computer Ji. This is the third dummy question. Okay, so DAS helps pump blood through the entire body. Is it lungs which pumps the blood, or a kidney, or a heart, or a brain? Your time starts now. So your time is over. Thankfully, Computer Ji has given something from the human body also, not only from the veterinary science. So Computer Ji, can we have the answers? C, heart. Okay, so heart pumps the blood through the entire body, and I again feel it will be 100% answer. Computer Ji, can we have the scoring system? Again 100%. So I feel everyone is ready. Nobody is clicking left and right, and we can start this North Zone quiz, fever foundation quiz, and we start with first question. Now you should be ready with the first question. Computer Ji, can we have the first question? So question one is, which of the following sensory loss occurs in syringomyelia? Is it pinprick temperature? Is it light touch? Is it position sense? Is it vibration sense? Your time starts now. Okay, so time is over. I hope everyone has clicked the answer out of A, B, C, D, one only. And we will see who is the fastest finger first for winner of the first quiz. So we asked in syringomyelia what sensory loss occurs, and Computer Ji will tell us the correct answer. It's pinprick or a pain and temperature. So you must be knowing it's an easy question. So it's a pain and temperature which is usually involved, because the fibers which are involved is spinothalamic tract. Okay, so these are the fibers which are crossing from the spinal cord. So syringomyelia may be also called syrinx, where the cystic dilatation occurs in the central canal in the spinal cord. And classical presentation is there's loss of pain and temperature over the hands and anterior chest and posterior chest. It's a nape-like distribution. And patient may present with non-healing ulcers. There may be a lot of muscle loss in the hands. But touch, vibration sense, position sense are usually spared. So they can feel touch and all, but pain and temperature they are not feel. So there may be trauma to the hands. There may be non-healing ulcers. So if you can see answer to the quiz, question number 1, 80% of the students have correctly answered. This is pain and temperature.
Ghanshyam,
Yes, sir.
Ghanshyam.
Dr. Nasiru, sir, you can add, sir.
See this, and the pain and temperature carried by spinothalamic tracts
Yes.
in the spinal cord. They decrease it in front of central aqueduct. So syringomyelia dilatation of aqueduct, they are the first to loss, mainly because of affection of spinothalamic tract. Thank you.
Yes, sir. So this may be
And Dr. Dr. Ghanshyam, like Arnold-Chiari malformations, post-tubercular dilatations, intramedullary tumors, particularly in the cervical and the thalamic, in the thoracic regions. So they are actually prone to develop syringomyelias.
Yes, sir.
Yes,
Welcome,
yes.
Dr. Ramesh, sir. So they have all added that syringobulbia is also another condition where this similar syrinx dilatation may be there in the brainstem also. So we have 80% correct answer, but winner will be one only for this question. And computer will let us know who is the fastest finger first for this question. So Dr. Kunal from Mahatma Gandhi Hospital, Jaipur, he took only 6 seconds to answer this. Congratulations, Dr. Kunal, for being the first questions winner. And I hope you continue your success in next questions also. So Computer G, can we have the second question next? Okay. So which of the following drugs has shown very good efficacy in the treatment of neoplastic fever in cancer? Is it paracetamol? Is it indomethacin? Is it naproxen, which is a C option, or is it D, anakinra? Your time starts now. We have a big jury today to answer and to help everyone after the question is over. So your time is over. So we asked in question 2, which of the following drugs has shown very good efficacy in the treatment of neoplastic fever? And Computer G will let us know which is the best drug for cancer patients to resolve this fever. Computer G, can we have the answer? Okay, naproxen. So naproxen is the correct answer. There has been various studies in which suggest that 80 to 90% of the cancer patients who are having paraneoplastic fever, they have a very good improvement with naproxen, not with the paracetamol, which is nowadays very commonly used in our acute febrile illness like dengue and all, which is the drug of choice. Indomethacin is more commonly used as an anti-inflammatory drug, especially joint disease and all. And I think Dr. Narsimlu will add anakinra, which is very fond of rheumatologists and where to use it. Very good anti-inflammatory. Sir, can you add some words about anakinra?
No, I agree with you. Naproxen is a drug of choice in cancer associated with fever. But sometimes even systemic JRL, naproxen works better than paracetamol. Anakinra definitely not a refractory cases we use. Not I'm not much aware of oncology fever anakinra.
Yes, sir. But you people use, sir, rheumatologists, IL-1, it's a IL-1 receptor inhibitor.
Yeah, we use
Even gout, sir, heavy high-grade fever with joint pain, gout also, it's a good drug for gout, acute gout. So people, resident will be very happy to know that anakinra. I think it's not available in India, etc.
They are not available in India.
And expensive also.
But the systemic cancer JR also is effective.
Yeah, it's very good. So Computer G, can we have the percentage distribution for this question number 2? How many? I think majority of students must have correctly answered. So, oh no. So question number 3 has been answered by the majority of people. It was naproxen, not indomethacin. So still almost half of the percentage, 42% have answered it correctly. And computer will let us know who is the winner for second question. Okay, Dr. Kunal again. So both first and second question are fastest fingers was by Dr. Kunal. So out of 40%, Kunal is the leading student for this quiz. It's a North Zone quiz. We have already had three quizzes for East, West, and South Zone. Welcome, Dr. Subbalakshmi ma'am, also to the forum, ma'am, for joining. And we'll take your help in the next few questions. Computer Ji, can we have the question number 3? Okay. So, which of the following is not associated with increased risk of ulcerative colitis? It's UC is ulcerative colitis, which is part of an inflammatory bowel disease. Is it urban domicile? Is it high socioeconomic status? Is it former smoker, or is it appendectomy or appendectomy? Your time starts now. So question is not, just remember. Thank you, computer ji. So time is over. The question has a negative stem. It was asked that which of the following is not associated with increased risk of ulcerative colitis. So everyone is associated with increased risk except for one. So computer ji will let us know which is the correct answer. It's former smokers. So ulcerative colitis is one of the disease in which smokers have slightly advantage. They have less chances of getting ulcerative colitis compared to a non-smoker. So it doesn't mean that everyone starts smoking, because the other type of inflammatory bowel disease, which is called Crohn's disease, the incidence or prevalence increases with smoking, maybe up to 3 times. So if you smoke, you may get Crohn's disease, if not ulcerative colitis. So answer was C, and I think our jury, maybe Dr. Subbalakshmi is a gastroenterologist from our institute. So we'd like to add some words to other options.
So definitely other options are there, which has been given, like urban domicile, high socioeconomic status, and appendicectomy. These are all associated with risk of ulcerative colitis. And yes, it is a genetic disease also. So if the family member is or parents are affected with this disease, then obviously if the complaints suggestive of this is present in the offspring, then we should suspect it a case of ulcerative colitis.
Yeah, thank you, ma'am. So there's a hygiene theory also. They say if you are exposed in early childhood more to these microorganisms, so you have less chances of developing ulcerative colitis. So that's why the UC of ulcerative colitis in India is slightly milder form and less compared to Western countries. So this is just a theory, proposed theory. And we can see 88% or 89% of the students have correctly answered the question. And can we have the winner for question number 3, Computer ji? Okay, so we have another winner for question number 3, Dr. Divyanshu. He's from Sri Mahant Indres Hospital, Dehradun. Congratulations, Dr. Divyanshu, for joining the North Zone quiz winners list. And he took only 5 seconds to answer this question. So it was slightly tricky with the negative stem. We usually avoid negative stem, but in quiz we can use those things also. We can go ahead with question number 4, Computer ji. So not putting a not or except in a question makes it more tricky. So you should be cautious about that. Computer ji, can we have the... Okay, so this is question number 4. A school child is diagnosed to have a chickenpox. He should be isolated from other school children till option number A is 2 days after the scabs are formed, B 3 days after the fever subsides, C 5 days after the development of pustules, D all the scabs fall. Your time starts now. Good. Time is over. I hope everyone has answered this in time. So question was, how long this skin lesions of this chickenpox are infective? And usually this occurs in children or school-going children. So we have to keep them away from the school during those infectious periods, because this is very infectious virus. So computer will let us know exactly what is the correct time. Is it A, B, C, or D? Computer, can we have the answer? Okay, so question answer number D is correct answer. All the scabs fall off. So until and unless these papular followed by vesicular, and later on these lesions get scab form and dried up. So until and unless these are dried up, you should not be exposing other children in school. So students should be kept at home away from exposing other children. And these lesions usually start from the chest or a trunk and followed by spread to the external part or hands and lower limbs also. Any of the jury will like to add some points to chickenpox? New vaccine has also come up recently.
No, I think the answer is correct. Also, even scabs are infective, so all the scabs that falls off, generally the spreading infection will come down.
Yes, sir.
But Pankaj, I have one more to add. I just want to anyway. See, isolating the infected child from other school children, practically it has to be till all the scabs fall off, because the school will not be allowed entry in the school. Other teachers and the other children will shy away from the child because of the obvious healing lesion. Yeah. So it is also not only preventive medicine, it is also a social medicine. So from isolated from other school children. So that is the point. Thank you, and over to the
so isolation is important. Yeah. Until all these lesions are dried up, then only child should be sent back to the school.
Yeah.
Unluckily, I think only 30% of the students were able to make it out, although it's a very common thing. And recently, a new vaccine for chickenpox.
I failed to understand this point is given in Davidson.
Yes, sir.
And Harrison.
So there's a single-risk vaccine, which is a recombinant, which is not a live vaccine, can be given in.
But unfortunately, only 30% are answering.
Yeah, 30%. So anybody has answered? Good.
New Davidson, New Harrison mentioned all, but I remember he mentioned Davidson, Harrison.
Yes, sir. Computer ji, can we have the winner for question number 4? Okay, so we have another new winner, Dr. Deepu Rajan. He's from ESI PGI MSR Basai Darapur, and he's from Delhi. He's from our city. Congratulations, Dr. Deepu, for joining the winners for this North Zone quiz. And I hope you continue your successful journey in this North Zone. Computer ji, can we go to the next question now? Okay, so this is question number 5. Which of the following is best related to gadolinium contrast agents? Is it nephrogenic diabetes insipidus? Is it nephrogenic syndrome of inappropriate antidiuresis? Is it nephrogenic systemic fibrosis or nephrotic syndrome? Your time starts now.
Best related to the gadolinium contrast agent.
So something to do with contrast agent. And one of the disease get precipitated when given this contrast. Okay, so time is over. So question was, gadolinium contrast agent causes some specific disease, and this gadolinium contrast is usually used in MRI images, magnetic resonance imaging, especially for contrast enhancement. Like we avoid the CT contrast with the iodophore or iodine containing contrast, we avoid in kidney diseases. So computer ji, can we have the answer first? Okay, is it nephrogenic systemic fibrosis? So similarly, it has been seen that patient who has renal failure, especially stage 4 and stage 5 with very low GFR, less than 30%, they are also should be avoided for MRI contrast agent. So you should not do a contrast MRI in these patients. They develop severe nephrogenic systemic fibrosis in which skin as well as subcutaneous tissue suddenly get whole thickened, something like scleroderma or also called scleroderma. So all get thickened, get fibrous, and very poor prognosis. Yes, sir. You can add something, sir. Dr. Narasimhan, sir.
Yeah, I fully agree. Nephrology system fibrosis.
Yes. Sir. So other than that, nephrogenic diabetes insipidus, it's again a genetic disease in which there's a mutation in receptor for vasopressin, which leads to polyuria and polydipsia and electrolyte disturbances, and nephrotic syndrome you all know. So correctly, I think 60% of the students have correctly answered this question. Contrast should be avoided in this kidney patients. Any of the jury want to add any special comments for any other option?
No.
Okay. So
But 60% well.
Yes, sir. Dr. Narasimhan, sir?
No, 60% of them answered, correct answer. But another 40% their confusion.
So majority of them have correctly answered, sir.
Yeah.
So full weight is to our students from North Zone, sir. We will be with students of North Zone. We are from North. So majority are correctly answering this quiz. So we can have the winner for question number 5, Computer G. Deepu Rajan again. Okay, again, this is from Delhi again, ESI Hospital, Pasai Darapur. Congratulations, Dr. Deepu, for coming to the winner list. So we have out of 5 questions, twice, Deepu has already answered twice, and one more candidate has already answered twice. So they are the leading for North Zone quiz. Computer G will have next question. Computer Ji, अगला question लगा दीजिए. Okay, so this is question number 6. Leptospirosis or leptospirosis infect human usually through. Is it intact skin? Is it nails? Is it conjunctival mucosa or D, hair follicle? Your time starts now.
Leptospirosis infection.
Thank you, Computer Ji. So time is over. I hope everyone has answered it correctly. Options were 4 options, and most of them you can easily make it out. So Computer Ji will let us know exact answer. Maybe some correcting is there. So conjunctival mucosa is the correct answer out of these 4. And leptospirosis present as an acute febrile illness, and it may present as a jaundice. It may present as a fever. It may present even as a AKI or a kidney injury. And usually in rainy seasons, especially exposure to these rodents and all, someone is bathing or drinking during in a village, there may be a pond, if exposed to a stagnant water, there they may develop a leptospirosis, and it may be fatal if not diagnosed early or not treated. So any exposed conjunctiva or any someone drinks, it's more of a mucosal exposure. So any ingestion of water which is contaminated can cause any exposure to ear or eye can cause this leptospirosis. Any of our jury members will like to add some more clinical findings?
Broken skin is also a site of infection. Here it is intact skin is given, but yes, if it is broken, then
if it is broken, so there may be some disparity, and we would have given full weightage to all the students. Yes. But it is intact skin, so only broken skin. I think last quiz we had broken skin also, one of the options. So still, I think 30% C was the answer, or 30% here. I think very few students were able to make it out. The conjunctiva can have, and these patients may have a conjunctivitis also because of leptospirosis. They may have a subconjunctival hemorrhage also in some of the patients, leptospirosis. So, Computer Ji, can we have the winner? Deepu Rajan. Okay, so from ESI, Pasai Darapur, again, Deepu Rajan is the leading with 3 answers. Name is so common that I can remember that he's already answered 3 questions. So, Computer Ji, we'll go to the next question. We have already completed 6 questions. We have 20 questions still. Anybody can join, and 14 questions are still there to win. Question number 7 is Ponset disease refers to, is it polyarthritis in disseminated tuberculosis, Is it anterior uveitis and disseminated tuberculosis, posterior uveitis and disseminated tuberculosis, or meningitis and disseminated tuberculosis? Your time starts now. Sponsored disease. One of the options is correct. Okay, so time is over. So if you read the 4 options, everyone has last word is tuberculosis. So I feel everyone, most of them have correctly answered, because tuberculosis is the question which is usually asked in all the even MBBS students. So here we have postgraduate student from the medicine. So Computer will let us know what is sponsored disease, and it's polyarthritis and disseminated tuberculosis. So this is the correct answer. That means this arthritis is usually happens in patients who are having a tuberculosis, and this is more of a reactive tuberculosis. So patient has any tuberculosis, any part of the disease, and because of autoimmune reaction and reactivity, they may have a polyarthritis-like presentation. And treatment is you treat the tuberculosis, this arthritis also goes off. So other than that, anterior uveitis is commonly seen in patients like ankylosing spondylitis and other autoimmune disease, while posterior uveitis is common in tuberculosis also, but it's not called Ponsett. Similarly, Ponsett is only for arthritis only. I think some of the jury will like to add more comments on Ponsett arthritis. It's important because
in Ghanshyam, we come across this Ponsett disease in rheumatoid practice. More precisely, it is extrapulmonary tuberculosis having inflammatory arthritis. Often people mistake as rheumatoid arthritis, because sometimes rheumatoid factor will be falsely positive. But this is the erosion doesn't occur, only synovial inflammation is there. Constitutional features are out of proportion to the joint pains compared to rheumatoid arthritis, and deformity doesn't occur, and Montauk stress will be strongly positive, and TB quantifier will be positive, and if you do search clinically or imagology, we do come across tuberculosis focus in extrapulmonary region, sometimes lymph nodes, sometimes urogenital, sometimes even osteomyelitis, tuberculosis, multifocal osteomyelitis of tuberculosis, and any other organ. But usually lungs are spared, regions exactly we don't know.
Yes, a very important point. Sir has specifically said that RF factor is not rheumatoid arthritis. All RF positive are not rheumatoid arthritis. So like this patient, if RF is even positive in 10 to 15% of the patient in a low titer, even if there's a no rheumatoid disease. So like in this patient, if there's RF positivity, people may treat as a rheumatoid arthritis only. But here it's a reactive arthritis. So if you aspirate, CV0 will be negative. If CV0 is positive or ALP is positive in joint aspiration, that will be called a disseminated TB or a musculoskeletal TB. So that will be different. This is Ponsett, this is reactive arthritis. So Computer Ji, majority have correctly answered 72%, and winner is again Deepu Rajan from ESI Hospital. Congratulations, Dr. Deepu, for another breakthrough answer within 5 seconds. So he's also not only answering correctly, he's answering fastest out of all the participants. So very, very wonderful performance by Dr. Deepu. And we can go ahead with next question. So this is question number 8. Which of the following anti-tubercular medication can cause hypothyroidism? Is it rifampicin? Is it ethionamide? C option is isoniazid, or D is streptomycin. Your time starts now. So tuberculosis, a lot of questions Computer Ji has given to the students. I feel majority of answer will be correct, and within maybe less than 4 seconds. So time is over. It was another question on tuberculosis, and Computer Ji will let us know, is it rifampicin or some other drug? Computer Ji. Oh, so it's not rifampicin, it's ethionamide. So answer is B. So ethionamide has been seen that it may cause hypothyroidism, and there's a similar sibling drug, prothionamide, which may also cause hypothyroidism, but not isoniazid or a streptomycin, which are the frontline drug. One more drug of antitubercular, I think PAS, para-aminosalicylic acid, which was used previously around 80s and 90s. It can also cause hypothyroidism, and because these drugs are to be given long term for months, so that should be checked. Computerji, we have not asked for the next question. Computerji, can we have any of the jury want to add any comments on this drug? Ethionamide, second line drug, or we can have the percentage distribution for answer.
Dr. Muruganathan sir has joined, sir. Good evening, sir. Welcome, sir.
Yeah, welcome, Manjula.
Good evening,
Very
Muruganathan,
nice.
sir.
I think good going. Good evening. Good evening. I think very good going, and last day. So you're rocking. Good. And you know, para-aminosalicylic acid also can cause hypothyroidism.
Yes, sir. Pass, sir. Exactly, sir.
So para-aminosalicylic acid can also cause hypothyroidism.
Exactly, sir. Correct, sir. You are correct, sir. So you are busy in your lecture or no hypertension. Still, you have correctly answered, sir.
Yeah, thank you.
Full marks to you, sir. Great, sir.
Thank you.
You missed your lecture, sir.
See,
Thank you.
Ghanshyam, so much division in the audience because we don't commonly use the drug.
Yes, sir. We can see 30% students have.
Narsimulu, in
other
those
drugs
days, EAS was the usual drug. Now they've changed. Yeah, that's right.
We are previously using for only multi-drug resistant tuberculosis.
Yes, sir. Ethionamide is second line drug. So can we have the winner for question number 8, sir? Computer G. Deepu Rajan. I don't know how he is answering fastest finger first. It's
Ranjan reading.
30. Deepu Rajan is done wonderful. Okay, so we have another question by Deepu Ranjan, and he's won the 8th question again. We can go ahead with the 9th question, Computer G. Which of the following most accurately describe hypothermia compared to fever?
Sir, this question we can pass. At least answer was shown already.
Yeah. Actually, answer A was by error it was shown. Let us skip this and take the 21st question. Yeah.
Otherwise, we could have seen his fastest finger first. You can.
What you can allow, but it was shown as A.
Okay. As per jury, we will skip this question because he has already answered this question. It was first question, hypothermia, and we have already discussed last 2 days question on hypothermia, that it is different from hyperpyrexia because there is no thermostat setting and your paracetamol and drugs doesn't affect there. So you need physical cooling and all. So we can go ahead with question number 10, Computer G. Okay. So jury will decide that we will have this quiz till 19th, or we will take one question from later on. Okay. So we'll go ahead with question number 10. And a patient who is chronic hepatitis B carrier delivers vaginally at 39 weeks of gestation. The baby should receive which of the following therapies on the first day of life? Is it hepatitis B immunoglobulin? B is hepatitis B vaccination. C is hepatitis B immunoglobulin and hepatitis B vaccination. D option is none of the above. Your time starts now. Request Computer G to keep the 20th question ready separately. If required, if jury decides, we can have 20th question. Otherwise, 19th question are good enough for judging. Not known winner. So time is over. The question was the pregnant female who has just delivered her baby, and she was carrier hepatitis B surface antigen or a PCR positive for hepatitis B, and which should be the ideal treatment for her baby. We can have the answer, Computer G. Okay, so it's hepatitis B immunoglobulin should also be given, and hepatitis B vaccination is also required for this person or a baby, because HBIG will give the baby immediate protection. It is a passive protection from the hepatitis B virus, which may occur to this baby while delivering, while exposure to the amniotic fluid. While hepatitis B vaccination is already there in the vaccination of children, it is already there and should be given in institutional delivery, is given within 24 hours. So here, as soon as baby is delivered, hepatitis B vaccination should also be given. This is the correct option, and we can have some comments from the jury if they want to add. Hepatitis B, it's a very endemic disease in India. A big headache for all the gastroenterologists and internal medicine people treating this chronic hepatitis B.
No, it is a common clinical practice, and it is quite easy question also. Passive active immunization. So yeah, correct.
But still it was tricky, and we have to see fastest first again.
Yeah.
So here we can see still 40% of the students fumbled with the answer. 60% majority are correct, and correct answer was combination of active and passive immunization for hepatitis B. Computer Ji, can we have the winner for question number 10?
Oh.
It's again Vipu Rajan. I'm not sure, Dr. Manjula, you have to see that other computers are working. They are able to click the answers, because I think even on midway, Vipu is already a winner. So majority of them, we have never seen this type of results for last 3 days.
Yes.
Okay, so I hope this.
No. As a jury, I would like to just give my comment. I think the quiz team, not the team, the organizational team who are in charge of this thing. Can you please check whether all other participants are connected, and are they pressing any issues or something like that? We will take some 2 minutes or 3 minutes a break, and let this RX events and Dr. Manjula, Dr. Krishna Kumar, and in consultation with Ghansham Pante and Dr. Narsimulu and others, give a final decision on this issue.
I think we should give full credit to the person, because this was announced, I think, 1 or 2 months earlier only.
Yeah.
So timing is fixed, so we should continue with the quiz, sir. He may be the outstanding student, sir. We cannot say there's some issue. We should continue, sir.
No. I have no problem. Let others also say. Dr. Narsimulu and others. I'm not from internal medicine.
We are speaking to RX event. 1 minute you give us, sir.
Yeah. Not from NARZone, not from internal medicine. So it is only an issue of knowing whether others are connected and are they hearing correctly and all. So let the RX team events communicate to Dr. Krishna Kumar, Dr. Manjula and others. I hope, sir, Professor Narsimulu, sir, is it okay with you?
Okay, sir.
Yeah. Please. Yeah.
We can see, sir. We are here for last 4 days, sir. So average attendance was around 100 to 180, sir, in whole of the last 3 days. So if we can have how many numbers are there, we can see.
Please. Yeah, that's what we want to know.
Dr. Manjula and Computer Ji can let us know how many.
Yes, sir. We are talking to them, sir. Give us a minute time.
Yeah.
Okay, we'll wait for some time. In between, we can have some comments from Dr. Subbalakshmi also. Hepatitis B. She's a gastroenterologist from our place. So a lot of hepatitis B, chronic hepatitis B. She's taking care of them. So
yes, sir, definitely we have to go with both the options, immunoglobulin as well as hepatitis B vaccination, because that is the way to prevent the child, the newborn, if the mother is already a carrier. And yes, sometimes if the baby is underweight, it is advised to take the vaccine at least after 1 month. We can give the time of 1 month, and then we can complete the dosage of the hepatitis vaccine, which is already in a schedule of newborn vaccination, as you already told, sir.
Yeah. We call it, I think its name is Indradhanush. Although pediatrics we have left many years back, but new program, thanks to the government, very colorful names and all.
The colorful name along with that card is also very much colorful. So you can know that this name is Indradhanush only.
Yeah, so Indradhanush is the immunization program for pediatric patients. And Dr. Sudarshan sir is from preventive medicine only. So You must be
Yeah,
very
yeah.
active involved in all
Yeah,
these
yeah.
immunizations.
I told passive active immunization is the therapy. Yeah. Immunotherapy. Yeah.
Yeah.
Madam, is it okay? Any report from
Yeah,
event?
yeah. They're telling, sir. Dr. Krishna is
Yeah.
speaking. 1 minute, sir.
Sir, I just checked with the.
Yeah,
Yeah.
Praveen. Yeah.
Yeah.
Go ahead.
I just checked with the back end. It's just that the last question, 6 of them have answered the right question, and the fastest is the doctor who has answered it. So we have the data to support that. Others too have answered, but the fastest is.
Okay. Okay. Yeah. How many are there participants?
Yeah. Team RX, can you tell me the live?
Yeah. How many are participating in the quiz?
Yeah, someone can come, turn on the speaker, and then can answer.
Yeah.
Yes. Yeah. What Praveen has told, I would like to second that.
Yeah.
For example, question number 4, we had 4 candidates giving the answers. Among them, Damini, Sahaj Singh, Dipuranjan were there. Dipuranjan was
Computer Ji, can we have, thank you Computer Ji for all the assessment. Computer Ji, can we have the next question? Okay, this is question number 11. Which of the following hepatitis B profile is consistent with acute hepatitis B infection? Is it HBs antigen negative, anti-HBs negative, anti-HB core antigen IgG positive, anti-HBe positive? B option, HBs antigen negative, anti-HBs positive, anti-HBc negative, anti-HBe negative. C option is HBs antigen positive, anti-HBs negative, anti-HBc IgM positive, and HBe antigen positive. And last option is HBs antigen positive, anti-HBs antigen positive, anti-HB core IgG positive, and HBe antigen positive. Your time starts now. Total acute hepatitis B infection, not chronic. So one of them is correct answer. And again, hepatitis B. So time is over. So Computer Ji, it's a very complex. So many test reports are there. Some are negative, positive, slightly difficult. So I feel it will be difficult for students to answer. Computer Ji, can we still have the answer for this question number 11? So answer is C, correct answer. HBs antigen positive, which may be positive in acute as well as chronic. Anti-HBs negative, which means antibodies against the surface antigen is usually negative because antigen is already positive. Anti-HBc, this is anti-HBc core antigen, which is IgM positive. So this is IgM is acute. So this is the correct answer, which will give you a clue that anti-HBc IgM should be done for patient who has maybe a needle stick injury, who has a recent exposure, or also this is commonly done in blood bank to see that patient is not in a window period who is donating. Otherwise, it can transmit this blood-borne infection to the recipient. And HBe antigen is also positive in this patient. So HBc core antigen positivity will give you a clue that patient is having acute hepatitis B. And correctly, 80% of the students have correctly answered this question. And very awesome. I think very good knowledge of these North Indian students. And I think hepatitis B, Dr. Subha has already told, it is a big problem for our country. And India comes in intermediate zone. Around 2 to 4% of the population is having this hepatitis B. infection in Indian population, which is moderate category or intermediate category. Can we have the answer and any comment from the jury? Again, Deepurajan is the winner for, and he took just 2 seconds now. So he's getting better and better. From 6 seconds, he's come to 2 seconds now. Any of the jury want to add some points on hepatitis B again on prevalence and immunization? So we can go ahead with the next question.
Yeah.
Okay. So question number 12. The patient complained of palpitation and was brought to the emergency room. BP reading was 82/60. She was hooked to a cardiac monitor and with a reading of atrial fibrillation. So atrial fibrillation was seen there and fast ventricular response. So rate was also ventricular more than 100. What is the most appropriate initial management? Is it carotid massage? B option is amiodarone 150 milligrams slow IV bolus. Is it adenosine 6 milligram IV bolus or cardioversion by electric cardioversion? Your time starts now. Thank you, Dr. Ji. So this was a clinical question where a female patient has come there in an emergency with palpitation and she is hypotensive. Her BP is 80/60. Systolic BP is on the lower side. She is symptomatic with palpitation and her ECG suggests atrial fibrillation. Okay. And most appropriate answer, Dr. Ji, can we have the answer? Okay. So it's a cardioversion by defibrillator because patient is hypotensive. So any patient who is hypotensive, symptomatic, and acute atrial fibrillation should be cardioverted. Although there will be some discussion, is it 200 joules or 100 joules or a biphasic or a monophasic current should be given. But nowadays, a lot of institute already has biphasic defibrillator, and they usually give 100 joules. But 200 is slightly more effective. Other than that, I think carotid massage is not effective. It's more often used in supraventricular tachycardia. Similarly, amiodarone could have been used if patient is not in hypertension or not in CHF, where amiodarone is given in 150 milligram IV bolus over 10 minutes infusion and followed by a 1 milligram per kg per ml per minute bolus is continued after that. Infusion continued for 6 hours. And adenosine is also only effective for supraventricular tachycardia or a PSVT. So this won't be the correct answer. So cardioversion defibrillator is the correct answer. Acute emergency medicine, most of the medicine resident must be seeing this AF patient, and 75% has correctly answered it. So any of the jury will like to add any comments on cardioversion, AED use, AF? So this, I think, anyone want to add? Any patient who comes more than chronic AF or who has the symptoms for more than 2 days and all, they should not be acutely cardioverted. So they should be first anticoagulated as such, if possible. But patient in CHF and hypertension should be immediately cardioverted. You should not wait for, because there will be more mortality in that. And stable patient and patient with even amiodarone can be used in those patients who are stable and who are more than 48 hours duration of AF. 75% correct answer, and we can have the winner, Dr. Deepurajan again, and he's taking less and less time. I think he's taken just 3 seconds to answer this question, and we can go ahead with the next question. Question number 13. Anti-SRP antibodies may be found in, is it dermatomyositis, is it polymyositis, is it inclusion myositis, or D option is immune-mediated necrotizing myopathy? Your time starts now. Thank you, Kapilji. So time is over. The diseases which has been enumerated are inflammatory idiopathic inflammatory myopathies or IIM is there. So slightly difficult question and more of a related to rheumatology. And we can have answer from Computer Ji, and Dr. Nasimlu will like to add some comments, special comments. He's expert in these myopathies. So answer is immune-mediated necrotizing myopathy, which is a rare form of idiopathic inflammatory myopathies. And I think 4 to 8% is the percentage of myopathies seen in this condition. And the full form of SRP is signal recognizing particle, which is a ribonucleoprotein. So Dr. Nasimlu will like to add, or any of the jury?
It's a very good question, but difficult question for postgraduate medicine. The question is for DM rheumatology students. If one of the cause of refractory myopathy, and often refracted to methotrexate, cyclophosphamide, most of the drugs, but the response is seen good with rituximab. So rituximab is a drug of choice in necrotic myopathy associated SRP antibodies.
Yes, sir. So a lot of necrosis is
for
seen.
muscle biopsy also.
So first steroid can be tried high dose and followed by CD.
Steroid is must. Steroid
Rituximab can be
but
used.
the steroid sparing drug. But I'm so happy so many people answered so rightly.
Yeah, so a lot of, I think rheumatology is more sort of a sub-specialization. So
New Harrison has given this, but Davidson not given this. So most of
this
the
is the postgraduate students, so they read Harrison only. The Davidson is for MBBS students. So 66% has correctly answered, and another of this SRP antigen is HMG-CoA reductase inhibitor. So that receptor is also included in this. There's necrosis of these receptors also. So can we have the winner for question number 13? Difficult question. Okay, so now we have Dr. Divyanshu. We have a different winner again, and he's from Sri Mahant Indres Hospital, Dehradun. So he's coming from Devbhumi. Good, Dr. Divyanshu. Congratulations. So can we have question number 14? Oh, sorry, 15 question we have reached. Which one of the following is incorrect in pathogenesis of leprosy? The lesion is Lucio phenomena have heavy parasitism with AFB and may be fatal. B is type 2 lepra reaction occur in lepromatous end of leprosy spectrum and present with erythema nodosum leprosum. Type 1 lepra reaction are downgrading reaction and seldom present with nerve trunk involvement. And fourth option was Mycobacterium lepra cannot be cultivated in artificial medium and tissue culture. This is the incorrect one you have to choose. Your time starts now. Time is over. Thank you, Computer Ji. So this was again with a negative STEM question on leprosy, which is a problem in Indian state. And we can see here lepra reaction type 1, type 2. A lot of leprosy patients are treated with dermatology, but we do see a lot of patients who comes to our neurology OPD or internal medicine with mononeuropathy, or maybe thickened nerve, or maybe a mononeuritis multiplex also. So Computer Ji, can we have the correct answer? Okay, so this is not correct. This is incorrect answer for leprosy. That means type 1 lepra reaction are downgrading reaction, which is correct, and but seldom present with nerve trunk involvement. So nerve trunk involvement is very hallmark of these reactions, both type 1 as well as type 2. That means they may present a sudden wrist drop. They may develop as a foot drop with sural nerve involvement. They may have an involvement of this ulnar nerve with the claw hand. So these one by one nerve involvement is classically said as a mononeuritis multiplex. So this is incorrect answer in the form of leprosy. This is commonly seen in lepra 1 reaction. Other than that, Lucio phenomena, this is severe form of leprosy where bacillary load is very high, not low, very high, which is the correct answer. And commonly seen in, I think, South America setting, but Indians in India also, they may present as a maculopapular rash with a severe mutilating disease. Type 2 lepra reaction, again, it is severe form of leprosy, where the AFB load or leprosy is very high. They may present as the Edmund nodosum leprosum, which may be an emergency set in these patients. And we know that Mycobacterium leprae is not easy to cultivate, similar to AFB of Mycobacterium tuberculosis. So correctly answered is not in majority. I think the correct answer was C answer. I think 1/3 of the students have correctly answered. And can we have any of the jury comments? I think leprosy is very important thing for PSM, as well as I said, even our rheumatologists or our internal medicine. It's very important, and it's very difficult sometimes to diagnose this thing. They come as rash, they may neuropathy, they may come as fever. Sir, any of comments from jury?
Yes, the presentation is very vague and atypical. So it is usually difficult because we think like neuropathy, if patient present to us with neuropathic symptoms, we think of some nerve involvement, but not leprosy as a first diagnosis. Though that should be this thing that we should think of this also, because it is very common in India, as you told, sir.
Yes, sir. So sometimes it's easy. Yeah.
It's
Dr. Sudarshan, sir.
It's equally important to palpate the thickened nerves, which we actually ask. So what I'm saying is that it's equally important to know how to palpate the thickened nerves for a postgraduate. So actually, whenever there is a CNS case, we ask them to palpate the nerves, and it's again a challenge for them. So it's just an addition to what you are saying, sir.
Yeah, so ulnar nerve examination is very important for these mononeuropathy and all. Sural nerve, ulnar nerve. So yeah, thickened nerve DD is one of the important questions in the examination of a neurology case. So thank you, Dr. Ramesh, and we can have the results for question number 15.
Yeah.
Okay, so we have a new winner today, Dr. Shikha. She is from Mahatma Gandhi Medical College and Hospital, Jaipur. Welcome, Dr. Shikha, and congratulations. And she took just 4 seconds to answer that leprosy may have a nerve involvement, which is a common involvement. So we can go ahead with the question number 16 now. Okay, so question number 16, autoimmune thrombocytopenia is the adverse effect of which of the following antitubercular drug? Is it isoniazid? Is it rifampicin? Is it pyrazinamide? Is it ethambutol? Most common. Your time starts now. Most appropriate, most common. Thrombocytopenia. Computer G. So your time is over. The question was, I think all the 4 primary drugs are there, and the question was which drug causes most commonly thrombocytopenia. And Computer G will let us know which is the common, because we all are using all 4 ATT, and it's a rare phenomena, not very common. We don't do TBC before starting ATT as such currently. So rifampicin is the answer. Although literature suggests that thrombocytopenia may be seen in all 4. It can be seen with isoniazid, it can be seen with pyrazinamide, as well as ethambutol. But rifampicin is the most common of them, but still not very common. But out of those 4 things, most common, and it is autoimmune phenomenon. So when you withdraw the rifampicin, the thrombocytopenia do recover, and if the culprit drug is identified, rifampicin should not be reintroduced, and should be, there is a headache that what is the next drug to be used. So second line drug, maybe a streptomycin should be added. So sometimes it's become very difficult to know that is it idiopathic ITP or is it drug causing rifampicin and all. But sometimes it may be very severe, requiring steroid, IVIG, or any immunomodulator in the form of IVIG and all. So any of the expert, most of them, tuberculosis is very commonly treated with everyone. Want to add anything on this? Will Computer G give us the results? Okay, so Computer G correctly said rifampicin has been identified by majority of the students, 50%, and any of the jury very actively involved. Thank you for joining us. Want to add anything about rifampicin causing autoimmune thrombocytopenia? Have they documented any of this thrombocytopenia during their medical clinics?
No. Well, rifampicin, when patient was on 82 3-drug or 4-drug regime, whenever thrombocytopenia comes, rifampicin was first we thought. Thank you, Dr. Ghanshyam, bringing this and educating the people who are participating is very important. The people not aware, they continue rifampicin and we buy the problem. So rifampicin is the most sensitive drugs causing autoimmune thrombocytopenia. We do come across once in a way.
Yes, sir. It's a rare thing, and even it's not even in percentage. Only case series or some case reports are there. But yeah, really documented and has been seen in clinical practice also by our colleagues also.
Yeah.
So we can have the winner for question number 16. Deepurajan again, and he's from ESI and he's from Delhi. That's a good thing. This is North Zone quiz, so I think all of the Jammu Kashmir, Himachal, Uttarakhand, Punjab, Haryana, Chandigarh, UP, Bihar, they all are involved in this North Zone. And the most commonly answered is from Delhi only. That is a good thing. That is a positive thing. So we can have next question, Computer Ji. Question number 17. Which one of the following statement is true regarding pyomyositis? This is pyomyositis, not polymyositis. It is associated with systemic disorder like SLE, rheumatoid arthritis. Is it glucocorticoid are the drug of choice? Aspiration from the muscle may show gram-positive cocaine pus, or a myositis antibody Jo1 is present, which is predictive of increased risk of lung inflammation. Your time starts now. As this quiz is fever quiz, a lot of questions are on fever, inflammation, and infection. So, and that's why a lot of inflammation is coming, and infection, antibiotics, antitubercular. So your time is over. This was the question number 17. And computers, you will let us know how to differentiate pyomyositis versus polymyositis. Computer, can we have the correct answer? So it's aspiration from the muscle may show gram-positive cocaine pus. This is option number C is the correct answer. As the word suggests, pyomyositis, there is a pus collection in some muscle. Commonly, this may be involving the anterior aspect of the thigh or a gluteal region, and even sometimes in the psoas muscle may be involved. And most often organizes gram-positive cocaine as it written in option C. Staph aureus is the commonest thing. So antibiotic is the treatment of choice. Other than that, options are not correct. Glucocorticoid will not help, will cause more sepsis. It may be associated with connective tissue disorder, diabetes, and other immunocompromised status. But still, confirmation is by collecting pus or by imaging. Maybe MRI imaging of the muscle will be very helpful. Myositis antibody Jo1 is positive in patient who has an inflammatory myositis with ILD. This is a classical syndrome like anti-synthetase syndrome, ILD with inflammatory muscle disease, nothing to do with pyomyositis. So this is also called tropical pyomyositis. So any of our panelists or a jury will like to add their experience with pyomyositis? Till computer shows us the results of percentage distribution.
Ghanshyam, very important again. We have to recognize pyomyositis where we should not use steroids immunomodulation.
Yes, sir. Steroid should be avoided, and antibiotic will be the thing. And if required, there's any pus collection, you should aspirate and see what organism gram stain, and maybe a culture will be a helpful thing. Anyone else want to add? And option C is majority of the students are correctly answered, 57%. So pyomyositis, they are able to make it out, and gram-positive foci. That is important thing to do. So culture sensitivity will also be important. So drug of choice will be maybe a vancomycin or a penicillin group will be effective in this patients. Please go ahead with question number 18 if Computer allow us. So sorry. So we have winner for question number 17. I missed it. As Dr. Neha Thomas. She is from ESI Basai Darapur, Delhi. So we have a new winner for this time. Congratulations to Dr. Neha for correctly answering the question on pyomyocytes. So we can go ahead with next question. Okay, so this is question number 18. It's a paraneoplastic cutaneous marker of internal malignancy with the hallmark finding being an abrupt eruption of multiple seborrheic keratosis. Which sign has been described? Is it trip palm sign? Is it generalized melanosis? Is it Lazar-Trillat sign, or is it Trozier sign? Your time starts now. The paraneoplastic syndrome, cutaneous syndrome. Thank you, Computer G. So time is over. So there are 4 options: tripe palm sign, generalized melanosis, Lazar-Trillat sign, and there was sudden onset of abrupt onset of these seborrheic papular lesion with hyperpigmentation in one of the malignancy as a paraneoplastic syndrome. Computer G, can we have the answer first? Okay, this is Lazar-Trillat sign. So in this, what happens that any patient who has an internal malignancy, like it may be a GI malignancy, it may be a pancreatic malignancy, it may be any genitourinary malignancy, which may present as a sudden appearance of these cutaneous lesions, and that may also be associated with acanthosis nigricans, like pigmentation also. So suddenly these erupts, and this may give you a clue that patient may have some internal malignancy. So imaging will help you, but more of a dermatologist will be the easy make these signs are more of a dermatologic finding. But once you see it, it will be very easy for you, as it's a spotter for them. Other than that, generalized melanosis means generalized hyperpigmentation, which may occur in again pancreatic malignancy may present like this. And tripe palm sign is hyperkeratosis, so that there's a thickening of the palm of the patient, sudden development of this, which may also suggest that it's a paraneoplastic syndrome. And Trozier sign is left supraclavicular lymph node. This is not a cutaneous sign. It's more of a lymph node enlargement, especially left supraclavicular lymph node, which may be again enlarged due to maybe a GI malignancy, especially like gastric carcinoma, left lobe of the lung may be involved, or sometimes even testicular malignancy may present as a left supraclavicular lymph node enlargement, which is called Trozier sign. So if you can see here, 62% of the students have correctly answered this thing. Anyone wants to add or has seen this Trillat sign anytime during their practice? I have not seen. I have just the Computer G has given me this question. Seborrheic keratosis presentation, sudden eruptions in a paraneoplastic syndrome may present with the fever, weight loss, and sudden eruptions. So, Computer G, can we have the winner for question number 18? So it's Dr. Neha Thomas. She's from ESI Darapur, Basai Darapur. Congratulations to Dr. Neha for correctly answering and within 5 seconds. So we have given 20 seconds, so she has just taken 1/4 of the time. Computer G, can we have the next question? Okay, so this is question number 19. A 12-year-old boy developed a painful brownish raised lesion over the back of his leg associated with surrounding redness, as shown in figure. You can see this figure here in the right side. 1 week after returning from a forest camp, so he's exposed him during a camp, the diagnosis was confirmed by a biopsy report showing microorganisms which when stained with Warthin starry stain. What is the most appropriate treatment? So some infection has occurred. Is it doxycycline? Is it amikacin? Is it metronidazole? Or is it ciprofloxacin? The time starts now. Thank you, Computer Ji. So the time is over. So there's a young boy who was going for hiking, and he got bitten by some insect, or he had got some wound. So that is very there's a red lesion which is raised and inflamed area. So you have a clue that something has happened here, and histopathology was done, and Martin's starry stain was used to stain this microorganism. So, Computer, can we have the correct answer for this infection? Okay, so doxycycline. So most likely it's an atypical infection. Very commonly used doxycycline for scrub typhus and all. But you all know scrub typhus, we don't use this Martin's starry stain, and this is more of a used stain in any spirochete infection. So gram-negative spirochete infection, which may also seen in a normal Giemsa stain, or sometime even with a dark stain, dark field microscopy. So this is commonly seen in this spirochetal infection, Borrelia burgdorferi, which is a Lyme disease. Very few cases has been reported from India, but very common in United States or North America. They may present as a PUO, they may present as a arthritis, they may present as a dementia, or they may present as a Alzheimer's disease also. So very mild presentation. And if you can see here, correctly answered doxycycline, 85% of the students have correctly answered this thing. Anyone wants to add anything about Lyme's disease? A rare thing, but common in North America or other continent. Lyme's disease. So we have a winner here, Neha Tomar, not common in India, but Neha Tomar again, I think she has successfully answered this question. Third time she has answered this quiz, Norjol quiz. So we have completed the 19th question, and we can go ahead with the final question. Computer Ji. Okay, this is the 20th question. 54-year-old male is admitted with pneumonia and diarrhea. Sputum staining revealed numerous neutrophils without any organelles. Blood investigation revealed hyponatremia and deranged liver function test. Chest X-ray showed patchy alveolar infiltrate, which you can see on the right side, with round opacities as shown in the image below. So there's a bilateral pneumonia there. Image B, there was a no response seen with beta-lactam antibiotics. So he was treated with beta-lactam antibiotics, most probably ceftriaxone. What is the most likely cause of pneumonia? Is it pneumococcus, salmonella, legionella, or E. coli? Your time starts now.
Hello.
Thank you, Computer Ji. So we have completed 20th question. Okay, so Krishna, after 20th question, we can have two more questions. I think there was some problem with display of question. Computer Ji, Krishna, has everyone was able to see the question number 20th? Okay, if there is a requirement, we can go ahead with another question. So Legionella is the infection which may present as a bilateral pneumonia, and which is also called atypical pneumonia. And here they may not respond with the beta-lactam antibiotics. So you have to give cover with any macrolide antibiotics or a newer fluoroquinolone. And they may present as a hyponatremia because they may be involved in SIADH. So there may be syndrome of inappropriate antidiuretic hormone release, which may cause hyponatremia in this patient, euvolemic hyponatremia, and sometimes they may also cause liver dysfunction. And to confirm this diagnosis, although sputum culture and sputum staining can help us, but you can even test urine for ELISA for Legionella, which is an easy to do test and with very good sensitivity and specificity. So Legionella is the correct answer, C option, and we can have the percentage distribution for the question number 20th. Any of the jury want to add anything about Legionella?
Sir, as you said, it is an atypical infection and it is actually found in fresh water normally. But if it is found in man-made water, that is the thing, that is the time when we are worried about, because then it leads to this type of infection and can spread like this.
So it can cause multi-system involvement, it may cause liver involvement as well as lung involvement. And majority of people have answered it correctly, Legionella. And can we have the results?
No, all have answered 100%.
100%. Okay, yeah.
Yeah.
But
Correct.
first is just sing.
Yeah.
Sorry?
Fastest
winner. First is the winner for this question. So
Yeah.
Dr. Saheb Singh is the new winner. He's from Sri Balaji Action Medical Institute, Delhi, and he correctly answered within 5 seconds.
Okay.
So we have completed with 20 questions, and we would like to know from the organizer and Computer G, should we run 1 or 2 questions more?
Yes,
Because
sir.
one
Sure.
question was shown,
Yeah.
and
So,
there was some display error. with
Yeah.
that.
Yes.
As a
Sir, for the
jury,
back-end team,
Just as a jury, is it okay if I speak or after Krishna Kumar?
Yes, sir. You can speak, sir.
Yeah. See, question number 9 and question number 14, there have been some issues. So participants should get the benefit of answering 20 questions. So we will have to go with the 2 more questions, the reserve questions. Then, and this should be operated very correctly, so that we give the participants the experience of 20 questions over. Others, please. Yeah.
Yes, sir. Any of the jury wants to add anything? Because one of the question was shown, but someone must have answered question number 14 also. So that
No, sir.
winner will
14 was not displayed. From 13, it went to 15.
15. So we can display 14 again otherwise?
Yeah, no, sir. Again, 2 more questions will come now.
Okay, Computer G, let us go with 2 more questions. Okay, so question number 21, which is the additional question. Which of the cancer does not have adequate evidence to link smoking as a causative agent? Is it bladder? Is it esophagus? Is it AML? Is it ovary? Your time starts now. Most of them are caused by smoking, but except for one. Thank you, Computer G. So time is over. You got 20 seconds to answer this, and this was the additional question. And this asks that all the cancer, most of the cancer has some relation with smoking, except one of them. And Computer G will let us know what is the correct answer for question number 21. It's ovarian cancer. So it's ovarian cancer most commonly seen in females, and most of the, if you say Indian setting, very few females smoke. That is correct. But you all know that bladder cancer is one of the common factor is smoking, which can cause bladder cancer. Esophageal cancer is also very common in smoker. And while acute myelocytic leukemia has some association with smoking. So the correct answer was ovary, which has no evidence as such to link it with smoking. More of this cancer occurs more often due to some genetic defect. And any of our jury want to add anything on smoking related? I think so many carcinogens are there in smoking. And any of jury want to add? Smoking related disease, although COPD and lung cancer are more important for this smoking, and that pack here and smoking index we usually calculate for every smoker, but this is related to more of a cancer. So anyone? Okay, so I think most of the jury is also tired of such a long quiz. So we are at the back end of the quiz, and we can have percentage distribution for the answer. And 50% of the students have correctly answered question number 21. So ovarian cancer is not linked to smoking. So, but that will not benefit any males by not smoking, because ovarian cancer is there in males. So we can have the answer. And for winner of question number 21. Okay. Neha Thomas, she has permanently come back last, I think 6-7 questions, she has
Yeah.
correctly answered many questions. So she must be on the merit list for this North Zone to the Bangalore trip. She is almost there, I think. So I think this 22nd question will help her maybe to reach first or a second spot. Best wishes to Neha and everyone. This will be the last question for quiz, unless we have a tie break. So if there's a tie break, we can go ahead with the 3 question or 1 question that we'll decide on.
We'll decide. Let
go
us
ahead
see
with
this.
final question. Yeah. Computer Ji, we will go ahead with question number 22. So the false statement regarding fever is daily variation of oral temperature may be 0.5 to 1 degree centigrade. You have to say false statement. The morning temperature is about 37.2 degree Fahrenheit. The evening temperature is more than 37.7 degree Fahrenheit when you call it a fever. And the rectal temperature is 0.4 degree lower than oral temperature. Your time starts now. So which is the false statement? So thank you, Computer Ji. We are done with 20 questions. Who were the additional question because of some technical error, and we have come to the 20 question.
Pankaj, I have some clarification. Don't move the screen. See this B and C. It is 37.7 degree F. It is written. If I take it as Fahrenheit.
Fahrenheit.
Yeah, but it cannot be 37 degree Fahrenheit. Am I correct? So it cannot be. It is centigrade. The answer is given wrongly. Others, please comment on this response categories. Yeah, other internal medicine specialists to please answer. Yeah. Please note. Yeah, this is error. 37 degree Fahrenheit is something totally different. I think let us repeat one more thing. Yeah, it is a wrong question.
Yes, sir.
Wrong question. Wrong.
This was degree centigrade,
wrong,
but wrongly
wrong.
written and
Not properly validated.
So we will have one more question.
Yeah, please. I am from community medicine also. Right. I am here to fine tune the operation.
Correctly, sir. You are quite correct.
Yeah.
Although people can interpret it, but still.
No. It is technically wrong.
Yes, sir. Computer Ji, can we have one question more from our question bank?
The following
findings. So which of the following finding will confirm a diagnosis of severe preeclampsia? Is it serum creatinine of more than 0.8 milligram per deciliter? B is serum AST or serum SGOT level more than 140 milligram per deciliter? Is it 1+ proteinuria on dipstick, urine dipstick, or blood pressure of more than 158 by 96 mmHg? Your time starts now. It's severe preeclampsia. Thank you, Computer Ji. So we have this time, first time we are gone to 23 questions in a quiz, especially North Zone. And thank you, Dr. Sudarshan. He has appropriately identified that there was an issue. So it is preeclampsia, more of a gynecological evaluation, but the reports which has been shown is more of a medicine. So Computer Ji, can we have the correct answer? So as per Computer Ji, this suggests that patient who has liver enzymes raised, especially more than 3 times. The normal values are around 35 to 40. So liver enzymes level more than 3 to 4 times will be labeled as a severe preeclampsia, although eclampsia is with seizure and all. So we all know that severe preeclampsia or a severe form will be having similar to like health syndrome, where there may be a signs of hemolysis, there may be a liver enzymes are raised, or there may be a platelets are reduced, or thrombocytopenia. So these will be the severe disease. So option B was correct. while serum creatinine 0.8 milligram per deciliter, which is normal value, will not label it as a severe, while 1+ proteinuria on a dipstick, which is a basic requirement for labeling as a preeclampsia, as well as BP for 158/96 doesn't match it to a severe category. So B was the correct answer. And any of our jury want to add any words to it, or we can go ahead with the percentage distribution for the correct answer. So Kaputaji, can we see the percentage distribution? So I think for 28% of the students have correctly answered, which is raised liver enzyme AST levels more than 140 milligram percentage, and this may lead to a fetal discourse if not treated properly or not handled properly.
Students have, I think, confused with raised BP also, because it is a sign of eclampsia actually. But in preeclampsia also we have to look for raised BP, which is there. But severe form we have to look for this HELP syndrome type of picture.
Yeah, HELP mnemonic will help you in detecting the severe form.
Madam, hypertensive pregnancy, preeclampsia, eclampsia, one of the causes, but the other causes of hypertensive pregnancy, so that cannot be more accurate. Elevated liver enzymes is more specific preeclampsia, severe preeclampsia, and proteinuria can be there in mild eclampsia also.
Yes,
so
sir.
elevated liver enzymes is more right answer. Yeah, I think answer is right.
Yes, sir. So can we have the winner for this question? Here, Dr. Sahej. He's from Balaji Action Institute. Congratulations, Dr. Sahej. I think he has already answered few of previous questions also. So best of luck to all the participants and congratulations to all of you. Participation is important. Winning or losing or that doesn't matter. It's just a quiz, but I think we all learned a lot of infectious disease as well as a lot of about fever, thanks to our Fever Foundation for arranging this quiz. So we can compile the results. Request to Dr. Manjula and her team to just compile the result, and if we are able to make it out who is the first winner and first runner-up. Any of the jury wants to add any comments, sir, till our team compile the result? If there's a tie break between first and second place, we will have to run a tie break again for 3 more questions. Okay, let's see what the results.
Are 3 more questions there?
Computer will help us from
okay. Good.
Sir, we have many tiebreaker questions.
Oh,
We can go long. Yes, sir.
Right. No, but dinner time.
Then we can have a dinner break in between,
Yes,
and
yes.
then again we will start the quiz.
Yeah.
Right.
So to summarize,
yes, sir.
We have exposed the participants to 20 questions, but there were 2 questions. Question number 9, there was a wrong hurried display. It was withdrawn. Question number 14 was skipped. So 2 questions were removed. So additionally, another 2 questions had to be played. Question number 21 and 22 were used. 22 responses were wrong. Instead of centigrade, it was Fahrenheit in the fever measurement. So one more to question number 23 came in. So question 9 and 14 eliminated. Instead 21 and 23, they are the replacement. I have made a note.
Yeah.
They are
Thank
the
you, sir.
replacement.
Thank you so much, sir.
Yeah. Only now I have to write down 2 names.
Yeah. So our scorer is ready with the results, sir. So Pankte, sir, you can ask the results and announce.
Yeah. So best wishes to all of you. Okay. So here's the answer sheet. Here we have 1, 2, 3, 4, 5, 6. We have 6 winners as such for the quiz for very well participation. And the winner is Dr. Deepu Rajan. He's from Delhi. And as I told you, Dr. Neha did very well in the last part of the quiz. So congratulations to both Dr. Deepu Rajan and Dr. Neha Tomar. And both are from Basai Darapur, Delhi, for winning the North Zone quiz. And you are welcome to join the fever conference in November in Bengaluru. and our Fever Foundation team will meet you and greet you and congratulate you. So congratulations from me and whole team of North Zone quiz team and jury and all. Well done. I think Deepurajan did very, very well, and as well as Neha and all other participants.
Yeah.
Congratulations to all the participants.
Yeah,
Congratulations.
Yeah. Without their participation, we could not have had the quiz.
So, Dr. Sudarshan sir, your final comments before.
Yeah, no final comment. It is fine. It was really a very pleasurable experience. And for me, being from community medicine, of course, I did not know the answers of many of them, but I could fine tune, not with the knowledge of medicine. It was science only, general science, centigrade and Fahrenheit. I could do some error correction. And of course, as a jury, I have not only ensured fairness, I have also ensured that the fairness is seen. So I thank Dr. Manjula, Dr. Krishna Kumar, and Mr. Jairaj and others from Microlab, and my esteemed jury colleague, Dr. Narsimulu from Hyderabad, and of course our quiz master, Dr. Gansham Panteji, and other experts, Dr. Subbalakshmi Margekar, Dr. Ramesh Agarwal, and Professor Jayant Kumar, and of course the computer team. Thank you very much for the invitation and for the
Thank you so
opportunity.
Much,
thank you very
Thank
much.
you so much.
I am here till it is closed here. Thank you very much.
Dr. Narsimulu sir, yours.
And thank you. At the outset, I congratulate all the participants for their active participation. I feel all the participants are winners. Only first and to name check will to give a prize, but all need deserve to be given prize. And I thankful my fellow colleague Sudarshan and Ghansam, excellent conductor Ramesh, Manjula, Jairaj for excellent participation, flawless. And some of the mistakes what my colleague pointed out have been corrected, and it is a fair deal of conducting MCQ, and I compliment one and all for this.
Thank you so much, sir. Dr. Subbalakshmi and Dr. Ramesh Agarwal from sir comments.
Yeah. So it has been a very good learning platform, ma'am, for the last 3 days, what we have been observing. And today, with the expert guidance of Dr. Sudarshan and Dr. Narsimulu, we have seen that the competition has been really fair enough. And whatever mistakes were there on the screen were rightly pointed out. And the quiz has been so well organized and so well, the questions had been so well framed that I feel that both the general medicine, the autoimmunity, the infections, all have been covered well. And it was a learning experience both for the participants and the jury and the, of course, for all of us. So I wish all the participants a very good luck. Subbalakshmi, you please can have the final comments.
Yeah, so it was actually a wonderful quiz. We all have enjoyed actually the last 4 days. We are listening, learning, enjoying. And yes, every question was a learning. Every question was very well framed. And yes, students must have learned a lot. They have answered or not answered, that is something different. But learning is a process that must be continued. And I think this quiz will, the quiz has made sure that yes, we should be learning. And very well organized. Everything was very nice. So thank you very much. And congratulations to all the participants who have participated and done very well in the quiz.
Thank you so much. Professor Jayant sir is also there. Sir, you would like to say, Panda sir, you would like to speak, sir? So, Gansham sir, with your permission, can I close the today's session?
Yes, ma'am. Please go ahead. I think we have a very entertaining and very academic session, and very well organized by Computerji. And in difficult times, and Computerji has helped us with this question bank.
Yes. So once again, congratulations to Dr. Deepurajan, Dr. Neha Thoma. Our Fever Foundation team will meet you and give you all the details, and you will be participating in the finals, which will be during FEFCON in November 2023. And I thank all the participants and congratulations to all of you for making this event very, very successful. Over to Mr. Jairat sir for final.
Yeah, Mr. Praveen will give the word of thanks.
Okay, Mr. Praveen, over to you.
Yeah.
Good evening to all the participants, and thank you for having participated. Without you participating, the fever quiz would not have been a successful event. And to make this a successful event, I thank Dr. Manjula ma'am and Dr. Krishna Kumar for having lined up such a wonderful, the flow of the event to planning and executing it to perfection. And the most important part of the Fever Foundation, or the pillars of the Fever Foundation, are our advisory board members. Dear sirs and ma'am, without you, things would not go smooth at all, things would not run at all. So I thank Dr. Sudarshan sir, Dr. Narsimlu Gumdala sir, Dr. Ramesh sir, Dr. Ganesh Gancham sir, and Shubhalakshmi ma'am, and Dr. Jayant Panda sir, and of course,
Anupam Prakash sir.
Yeah, Dr. Anupam Prakash, and of course our one of the pillars and the important people like Dr. Jagdish Chinnappa sir and Dr. Muruganathan sir, who have been with us throughout. And this quiz, I mean, last 4 days, I thank all the quiz masters who have kind of taken the quiz program to such a great level that definitely I feel that the bar has been raised this year. And the way Dr. Gancham Pantesa was like a marathon runner, he was taking up the the questions and answers, and the wealth, the knowledge wealth that was shared. It's amazing. We are blessed to be associated with all the Fever Foundation advisory board members. And sir, looking forward to have you all the winners along with the advisory board members in Bangalore, either through Zoom or person, depending upon the scenario or the situation. And thank you so much. And we shall do much better in the coming years. And of course, my mentor, my guide, Jairat sir, who has always been kind of pushing and making things happen. And I'm sure his guidance has definitely helped the Fever Quiz to achieve such great heights. Thank you to all, and good night.
Good night.
Good night. Thank you. Thank you, sir. Good night.
Thank you.
Good night, sir. Good night.
Namaste to all. Thank you.
Good night, everybody.
Yeah.
Recording stopped.